Hi, and welcome to Public Health Spotlight. My name is Tammy Griffin, Public Information Officer for the Wicomico County Health Department. Public Health Spotlight is a program that highlights the variety of programs and services available through the Health Department and creates discussion around public health concerns in Wicomico County. Our topic of discussion for this segment is prescription misuse and abuse. Joining us is Melissa Beatty-Johnson, Chief Operating Officer for Riverside and Milford Street Pharmacies. Melissa, thank you for joining us.
Thanks for having me.
Melissa, tell us a little bit about what is the sort of ongoing or growing problem with prescription drug abuse in Wicomico County.
Sure. Wicomico County, like many counties around the state and around the country, is struggling with a variety of different substance abuse issues. Prescription drug abuse in Wicomico County, particularly with regard to oxycodone, has seen a significant rise in the last several years. The diversion of prescription drugs, the overuse or misuse of prescription drugs, and really the drug that concentrates the most on are the opioid painkillers like oxycodone, because unfortunately those are the ones that contribute most often to overdose deaths. And Wicomico County is third in the state, unfortunately, for overdose deaths. So that really has brought some attention to bear on the problem here.
Where is the thought behind how individuals are gaining access to prescription drugs?
Well, prescription drugs are a little bit tricky. I mean, if you think about our language, if you will, when we talk about drugs, a lot of times we're talking about illicit drugs, we're talking about street drugs. You put the word prescription in front of it and suddenly it's something that's intended to help your health. So there are a lot of different ways that people are getting prescription drugs. Many of them begin with a legitimate prescription for a legitimate medical need. And I think it is important to note that these aren't inherently bad drugs. Used properly under the care of a physician, they are important in the treatment of many different health conditions. But they are also highly addictive. They're considered a Schedule II drug, which means that they have a medical use, unlike an illicit drug, but they also have a very, very high potential for addiction. So someone who is taking those drugs for a legitimate condition can become dependent on them. And if that dependence isn't monitored, isn't addressed, it can progress then into addiction. So someone who starts with legitimate prescriptions may end up after the fact buying or borrowing or taking prescriptions from friends, family members, from other homes as well.
Okay. And is there other means of access as well for individuals to get prescription drugs?
Well, generally speaking, somebody's got to have a prescription. Mm-hmm. So someone is going to the pharmacy and they're filling that prescription. But yes, unfortunately, if an individual who is dependent or who is addicted does not have a legitimate prescription anymore, perhaps the prescriber has determined that they should no longer be taking the medication. Unfortunately, there is a significant issue with diversion, or with people selling their own prescriptions to people who don't have prescriptions for those products.
Okay. Can you explain a little bit more about prescription diversion or drug diversion?
Sure. It really is the sale or even giving away of a prescription drug that does not belong to you. So if, for instance, I have a prescription for anything, but in this case we'll talk about something like oxycodone. If I have a prescription for oxycodone and I had a dental procedure, let's say, I didn't use all of them, and then I decide to share them with you or sell them with you. In either case, by transferring that controlled drug from me to you without a prescription, that's diversion. And it's not legal, unlike pretty much anything else that you buy. Once you have it, it's not up to you how to use it. You have purchased it, it belongs to you, but it's only legal to use as directed by the physician. So I can't then decide that I want to share it with my friends.
Why do you think that the prescription drug misuse is so widespread?
Well, I think there are a couple of different reasons. Unfortunately, something that we hear a lot from kids, from teenagers, I'm doing a lot of work with high school students right now, is that they say, well, it's easy to get. And I think part of that has to do with our society's attitude toward prescription drugs. There's a prescription to fix any problem you have, you know, whether it's blood pressure, diabetes, weight, anxiety, it doesn't matter. If there's a condition out there, if you've got a problem, somebody's got a drug for it. So we tend to look at prescription drugs as an easy solution. to a lot of problems. So kids say, well, it's easy to get. No one looks at you like you're doing anything wrong if you're taking a prescription. So that's a big reason that people do abuse the prescription drugs. Another issue that we're facing in Wicomico County is kind of the back and forth between heroin and oxycodone. Oxycodone is an opioid analgesic. It's a painkiller that is very similar in the way that it works and even in its molecular structure to opium, to heroin. So we do see a lot of people, when there's pressure from law enforcement on heroin, we see an increase in the abuse of oxycodone, and when there's pressure on oxycodone, we do see a spike in the use of heroin locally.
Okay. Tell me a little bit, what reasons do adults give for abusing prescription drugs? What are some of the things you hear?
Well, in a lot of cases, again, it goes back to why prescription drugs instead of something else. Well, they think it might be legal because it isn't heroin. It's not an illegal drug. A lot of people abuse prescription drugs initially to address pain. Yes, they want to treat pain, but it's important, I think, to realize that prescription pain drugs treat a symptom. They don't treat the underlying condition. So they don't treat torn ACLs or ruptured appendices or whatever the source of migraine might be. They just treat the symptom there. So people may be looking to treat pain, but if they're not consulting with their prescriber, then they're not actually figuring out what's going on underneath. Now, beyond that, there is definitely the feeling of euphoria, the high that comes with the abuse of the oxycodone and the other opioid drugs. And so it's a little bit more socially acceptable, I think, way to get high, or that's the perception that we've seen.
You say you're doing a lot of work with youth and that you're in the schools. Do the youth give reasons as to why they abuse, or what they see why youth are abusing prescription drugs?
Sure, and again, that goes back to first the perception of safety. If you got a prescription from a nice pharmacist in a clean pharmacy and it's a well-labeled vial, there's a sense of safety. It's all neat, it's all tidy, this has got to be safe. Just because it came from a pharmacy doesn't mean that it's not potentially very harmful. So there's that sense that this is a safer way to get high than using an illicit drug, which is a misconception. But there's also the sense that nobody's looking at them funny if they're taking a pill, that it's a little bit easier to get away with, if you will.
Okay.
But they're very, I've been very fortunate in talking with these students over the course of the spring. I was very grateful that they were willing to discuss the issue with me, and they're very knowledgeable. They're very willing to say, yes, it goes on, and here's why it goes on, and here's how it's being used.
I know in a previous segment when we had your father on, we talked about farming parties. Is that something that they've talked about? Is that still something that's happening? Are there other trends that the youth are involved in?
Well, we're not hearing as much about the farming parties now, and I was extremely glad to hear the students that I spoke with saying, that sounds like the dumbest idea I've ever heard. But you have to talk about the fact that yes, we can sit here in a classroom and you can tell me that sounds like the dumbest idea you've ever heard, but it's a lot harder to think that way if you're with a group of people who've already decided to do this and may or may not already have had some other substance that alters their judgment. So it's something that objectively, I'm happy to say, students locally see as a really bad idea. The interactions of all those different substances, you just don't know what you're getting into. Trends, I think, follow some of the national trends as well. They're definitely very aware of the abuse and misuse of the codeine cough medicines. And that's really been something that has been celebrated almost in pop culture with the scissor or purple drink. And when you hear that, what they're talking about is a codeine cough syrup combined with soda. And so instead of a dose of a teaspoon or two for cough every 4 to 6 hours, we're talking about maybe 4 ounces of a codeine cough syrup combined with soda. So that's an extremely dangerous dose.
That's interesting.
Yeah, that's one that, it's very much referred to in pop culture and music, and the kids definitely know all about that one.
Yeah, I can see that one being easier to just, you wouldn't even know what the person is drinking.
Right, exactly.
Yeah. Tell me a little bit about what are some things that adults and parents can do to sort of secure their prescription drugs?
Sure. Well, I think first, just knowing that you have to secure your prescription drugs is important. That they do need to be somewhere secure, that they do need to be somewhere that, not just that your children can't get to them, because hopefully you're having that discussion with the children and you have some communication there. But there have been instances, certainly, of people coming into homes, visitors coming into homes, people providing home services, going through the medicine cabinet and taking prescription medications out. So making sure that they are secure, preferably locked, in a place that isn't the medicine cabinet over the toilet, because that's where someone who's looking to take prescription drugs is going to go. But I think it is important that people are clear about their responsibility for those prescription drugs. Once it is in your hands, you've got to be responsible for them. I think the biggest thing that people can do, particularly parents, because another class of drug that we haven't really talked about are the stimulant ADHD drugs. Those are also highly addictive, and it's pretty underreported, the misuse of those drugs, because the group of people who are most often abusing them are high achievers. They are high-achieving students, they are college students, they're people who are trying to keep themselves awake and alert for long periods of time so that they can get a lot of work done. And because of that high-achieving status, there's not been a lot of reporting. No one wants to get them in trouble. But the long-term effects are starting to look like symptoms of schizophrenia in these kids. But those prescriptions are in a lot of households. And as kids grow, as they reach adolescence, the prescriptions change very, very frequently, as they should. So really the number one thing that parents can do with those prescriptions is get rid of them. When the prescription changes, don't leave it in the back of the medicine cabinet, get rid of it. And the health department has done a lot of work with local law enforcement to put the prescription drug drop boxes into the police stations. And those are great. They're a fantastic resource. They've disposed of more than 1,000 pounds of unused prescription drugs, and there's no paperwork. That's what I really want people to know. It's not a matter of you're going to go into the police station, do a bunch of paperwork, it's going to take an hour. No, you walk in, it's like a mailbox. Things go in, they don't come out. You take your old or expired prescriptions in, you put them in the box, and you walk away. But I think particularly with regard to those ADHD drugs, that's the easiest way to just get them out of there.
Yeah, that's really good advice. Do they take like liquid, like that you mentioned?
No.
Okay, so it's only
right. It's only tablets, capsules. They can't take sharps or liquids there. That's a good question. That's something we need to look into.
Yeah, that's great. Okay, tell me a little bit about the prescription drug monitoring program.
Okay, Maryland's prescription drug monitoring program began collecting data in August of 2013. Reporting was available beginning, I believe, in November. So pharmacists and prescribers, in addition, prescribers outside of even dealing with controlled drugs can have access to this program. But really the way that it's intended is that prescribers and pharmacies can log into the prescription drug monitoring program and look up patient profiles. It's very strictly controlled in terms of how it's intended to be used, but it does allow prescribers and pharmacies to monitor how often, where, and how a patient is getting controlled drugs. So it just tracks those drugs, anything like a benzodiazepine, the opioid analgesics, or these ADHD drugs. Those are all tracked in there. And it really is intended to help limit diversion, particularly from patients who are doctor shopping and pharmacy shopping. And that's really where it comes in handy. You can look in there and say, well, it looks to me that you do have prescription insurance and you filled a prescription for this same thing across town 2 days ago. No, we're not going to fill that one today. So the idea is to keep those illicit prescriptions from getting out onto the street.
So pharmacies then don't necessarily have to sell drugs to a person?
No. Even a legitimate prescription can be denied if there's clear evidence that the patient is seeing multiple doctors and obtaining multiple prescriptions. No, in fact, pharmacists have a corresponding responsibility and then by extension a corresponding liability for dispensing appropriately. So they are required to use their judgment to ensure that a prescription is being dispensed for a medically necessary reason to a patient who isn't also getting it from other sources.
I know you mentioned that the health department has sort of helped to establish some prescription drop boxes throughout the county, and also that there's some work being done through a prescription drug task force. So would you like to share a little bit about what's being done in that group?
Sure. The prescription drug task force grew out of really an epidemic of oxycodone abuse in 2011, 2012. The initial task force was primarily law enforcement, and once that program, by necessity, had to change, it went to the health department. And it's a great program because it pulls together healthcare practitioners, law enforcement, the health department, social services, and everyone can really look at the issues going on surrounding prescription drug abuse and how best to address it in Wicomico County. So some of the things that have been done include, of course, the prescription drug drop boxes. We do have a speakers bureau that will send folks out to talk to an organization, whether it's a school, a youth group, a church group, PTA, book club, it doesn't matter. If there's a group that wants to learn more about prescription drug abuse, that's a resource certainly as well.
You have a group that's ready to respond.
Yes, ready to go.
Great. Great. So what do you think that we can do? Are there other things that we can do as community members and as residents here in the county to help this public health issue? What can we do?
Well, I think one of the things, and I beat this drum pretty much wherever I go, is to not shut up about it. Unfortunately, addiction is definitely an issue that it causes shame and embarrassment, both for the person who's addicted, for friends, for family, and unfortunately that leads to a lot of silence, a lot of turning inward. But that silence can literally be deadly in this case. So really speaking up if you have a concern about a friend or a family member, and with the knowledge that a person who is in the throes of addiction will likely deny and worse. You know, they'll probably say some really nasty things to you, but speaking up rather than hiding the problem or helping to hide the problem to protect the addict, to protect yourself, really can be dangerous. So I think making it an open discussion rather than an open secret, which I think is what we have a lot of now.
Yeah, and I think that we tend to sort of take other types of illnesses and diseases and sort of embrace them and help people, but with something like addiction, it's a little bit different. How do you see the response in the medical community as well as, you know, with people within the community and how they respond to people who are suffering from addiction?
Sure. I think I'm happy to say that I think once an individual is ready to seek treatment, someone who is ready to get help, I think that our community has opened up a lot more, that there are resources, that people are willing to embrace them. But addiction is tough, and unless someone is ready to seek help, our community has a tough time recognizing what's going on there. But there are a lot of resources here, but it is an illness. It is something that merits our attention and the medical community's attention. And unfortunately, because of the issues with diversion and abuse locally, we've had kind of a pendulum swing. I think we're swinging back to a happy mid-ground here. But for a long time, even patients with legitimate prescription drug needs couldn't get the medications that they needed because so many people were afraid of these drugs. But I think there are a lot of practitioners locally and certainly in the health department that are working with people to get the treatment that they need, both for their medical conditions and for their addiction. And that's a very tough balance because, again, most of these people, nobody signed up to be an addict. Yeah. So most of these people are also dealing with legitimate medical concerns as well.
Okay. If there was anything else you wanted to add, or if there was sort of one thing that you want, one kind of message that was tied up in a little bow, what do you think that message would be for the community?
Well, I think probably the fact that despite all of our preconceptions about what an addict is, and I use this term knowing that it is offensive, what a junkie is, despite all of those preconceived notions, they're wrong. Prescription drug abuse does not affect a specific age, gender, race, socioeconomic background. It doesn't matter what you wear, what you drive, where you live, or what you look like. Prescription drug abuse is really something that affects every demographic in Wicomico County.
So it's good to know that there is a lot of work being done to address that.
Absolutely.
That's good.
Yes.
Okay. Melissa, thank you so much for joining us today.
Thanks for having me.
Thank you for joining us on PAC 14. If you have any additional questions about today's programming, please feel free to contact the Wicomico County Health Department at 410-334-3480 or visit us on our website at www.wicomicohealth.org. Thank you for joining us, and we'll see you again next time right here on PAC 14.